The Australian healthcare system. Australia has a very affordable, accessible, and comprehensive healthcare system. It is comprised of many funders and healthcare providers, as well as both public and private hospitals. The roles and responsibilities are split between different levels of government and non government sectors. The federal government's funding has three main schemes, which includes Medicare, the Pharmaceutical Benefits Scheme, and the Private Health Insurance Rebate. The overall aim of the healthcare system is to allow access to all, regardless of personal circumstances. Public hospitals. Public hospitals are owned by state and territory governments respectively. As of 2011, there were 753 public hospitals across Australia, which is an indication of how big the public sector is. Urban areas usually contain public hospitals of a large size compared to rural and remote areas where public hospitals are considerably smaller. A major strength of public hospitals are that they are funded by state and territory governments as well as the Commonwealth Government. This ensures that everyone has access to free public healthcare services. This strength, however, puts a large amount of pressure on the hospitals as they cannot respond to such high patient demands. This has resulted in an increase in waiting times for non-elective surgery. In order to reduce these waiting times, both government and non-government organizations need to fund more to create bigger hospitals with more beds and staff, which will allow the demands to be met, thereby reducing pressure and improving access. The private sector is a major part of the Australian healthcare system, with the expenditure accounting to approximately one-third of all healthcare costs. It is composed of organisations that are privately owned and not part of the government and can operate for profit or non-profit, and refers to private health services and private health insurance. It is responsible for the provision of health services including private hospitals, private medical practitioners, pathology services, pharmacies, and other services provided by fee-for-service providers such as physios, dentists, audiologists, and other specialists. This is an advantage of the sector as it incorporates the provision of specialist consultation, which can be subsidized if the person has private health insurance. There are limitations to private sector service provisions, especially in rural areas where access to private hospitals or physicians is limited due to locality. There are also different criteria used in public versus private hospitals that determines access to new technology and some drugs not yet on the PBS. Health insurance. In Australia, we have a choice when it comes to health insurance. We can choose to obtain our healthcare solely from Medicare or use a combination of Medicare and private health insurance. Medicare is a universal public health insurance scheme funded by the government via taxpayer dollars. It encompasses hospital, medical, and pharmaceutical aspects. However, because Medicare does have limitations in what it covers, private health insurance can offer several advantages over the public health system. Private health insurance offers cover for some of or all of the cost of items not covered by Medicare, such as ambulance cover, dental, and allied health services, and enables individuals to select a type of cover that suits personal circumstance. To assist individuals with the cost of private health insurance, the Australian government offers a rebate to most Australians with hospital, general treatment, and ambulance policies. While private health insurance offers individuals the opportunity to be treated by a health professional of their choice and reduces waiting time for elective surgery, it does increase the social divide in Australia and reallocate funds, thus resources from the public to the private health sector. Rural health. Rural health is an important concern in Australia because of the size of the nation and the distances between the capital cities and rural centres. As a result, the availability of healthcare services and health workers varies substantially in different locations. Strengths. In an attempt to address the difficulties associated with rural workforce retention, the Australian government has developed a range of rural clinical schools and university departments of rural health in the early 1990s. The aim of these initiatives was to encourage medical students to undertake their career in a rural setting by providing them with long-term placement options in rural areas. In addition, the government also provides scholarships for financial assistance to students as a means of encouraging them to partake in their placements in a rural area. Research has shown that students who complete part of their education in a rural area are more likely to pursue a career in a rural location. Weaknesses. Rural populations have poorer access and less choice of a number of healthcare services due to the location of their community. In these rural areas, there is substantially less general practitioners available, as seen in the graph below. Ongoing issues surrounding rural health workforce have been associated with problems such as overtime pay, social isolation, and recruitment and retention of health workers. Pharmaceuticals. Australia has a universal program called the Pharmaceutical Benefits Scheme (PBS), which allows all Australian citizens to access certain medications at a reduced cost. Medications which are placed on the PBS must first be considered by the Pharmaceutical Benefits Advisory Committee, and after their deliberation, they can choose to recommend a drug to the Minister of Health, who can approve the drug for it to be placed on the PBS. Strengths of the PBS include that approximately 80% of all prescriptions in Australia are subsidised through the PBS. Furthermore, the PBS is based on the principle that the price of medications should not inhibit individuals from accessing necessary medications, with costs based on concessional and general patients. In 2016, for concessional patients, they would pay a co-payment of $6.20 for PBS medications. For general patients, they will pay a co-payment of $38.30. A weakness of the PBS is that it can take a substantial amount of time for new drugs to be placed on the PBS due to the lengthy process of assessing the efficacy, safety, quality, and cost effectiveness of these medications. Thank you for listening.